Hello, my name is Sandra, and I'm going to do my presentation regarding how to nebulize a patient um, on ventilator, or in general. In my case, will be my patient is my daughter who is connected on the ventilator because her diaphragm is not working properly, so she needs the ventilator in order for her to maintain her lungs moving. So first I'm going to read what is a nebulizer, because I'm not a professional, I'm just a mom who learned how to do this on my daughter daily. So what is a nebulizer? A nebulizer is a device, I have the device here, that turns liquid into a mist. As you breathe, the mist medicine moves into your lungs. The nebulizer is usually connected to a machine that pushes the air through the nebulizer. The air helps turn the medicine into a mist. When a nebulizer is used, it is called a breathing treatment or nebulizer treatment. But why do I need breathing treatments? You will ask, right? Well, there's some people that has asthma, chronic disease as a COPD, or obstructive pulmonary disease, lung infections such as pneumonia, severe allergic reactions. But how do I use a nebulizer? First, I wash my hands. So you have to wash your hands and prior to do all of this. I already did. Sometimes I use gloves, but because I do this daily, I already wash my hands and I prefer to do that without no gloves, but you can do gloves as well. Then you got to prepare the machine. This is the nebulizer machine. Prepare the medicine. I have the medicine here. Let me tell you that she uses albuterol that clear her lungs, ipratropium, and she uses the Osodin. These medications are prepared specifically for her treatment, but you just go what your primary care doctor or pulmonary care doctor advise you to do so. This is particularly for my daughter. So then add saline water if needed. This is a saline water. It comes in a pink package. I don't use this. My breathing therapist doesn't use it. He used it specifically to go to her trach, but not in the nebulizer machine, so that's different. Okay. It says here that you can place the mouthpiece. I'm going to do that. I'm going to explain the names of each item, but this is the mouthpiece. She doesn't use it because she's not able to hold it through her mouth, but this is the mouthpiece. Okay, so let me introduce you the pieces names. This is the cup. You pour the medication into the cup. This is the long tubing that is connected to the machine, and you're going to connect it here into the cup like this. And this is the T. The T is called because it's going to be connected, the wider part, to this part. Let me show you. I just have to show you first the names of each item. We don't use this. That this is like an accordion tubing. Accordion. I don't use that piece neither. There's some other people that use it. That uses because they are not on ventilator, so they can do this. Let me show you how it works on my daughter. I'm not going to talk about this, but let me show you. If you can see, I'm going to pull this out. See, I'll pull it out. I put the wider piece, the thinner piece, I'm sorry, the smaller piece into her other tubing, and I'm going to connect this here. Then I'm going to introduce all the medications. She uses 3, so I'm going to pour 1 here. I'm going to put the albuterol, the ipratropium, and the budesonide. These all 3 medications clear her lungs and makes her breathe better. So I'm going to put this into here, and then I'm going to turn on the machine in order for her to receive that that aerosol mist. Okay, but first let me show you how you can see the mist in there. Okay, the medication. I'm not sure. See the mist here. This is what it's going to her lungs, so she can breathe better. Okay, so let me, before I do that, how do I take care of my nebulizer? I usually clean it with peroxide oxygen, or you can have some alcohol wipes as well. If for some reason you have a malfunction, the machine, you have to get a spare one. I have my spare one. Keep it in my cover here. But in case that you don't have any, you have to call the company that provides all the material, let's say, or the items for their care. If not, it says here that you can call the 911 if you feel the muscles around your airway tightened, your breathing gets worse after the treatment, or your chest suddenly feels tight after your treatment. She usually receives it very well, so she doesn't need to call 911 for that. She gets used to that. But if you need it, if you feel that your hands, arms, or legs are shaken after the treatment, or you have fever, or sore throat, mouth and throat, or the symptoms do not improve, then you have to call 911 or your physical doctor to provide the help that you need. Of course, you always have to go what the doctor says. So I'm going to prepare this for her so she can receive her treatment. Usually gets for 15 to 20 minutes and it will be done. Then just unscrew everything, clean it with mild soap and water, let it dry, naturally, and then that's it. That's what I do every single day with her, and this is it. So I'm going to turn it on right now. And here, and I put something here, so just to the liquid won't fall or it won't bend. So you just have to make sure everything is tight correctly here. So usually this helps me, sometimes it doesn't. See, the medication start falling, so you just have to make sure. So this one really doesn't work, so I have to put a pillow. Sometimes a pillow helps here. I usually do that, but you know what? This is not working today, so for some reason, so I'm going to do this. That's because I have to put it a little down. Her bed is medical bed, so you can do that. This happens sometimes, but it's okay. It's okay. Alright. That's basically what I do every single day, so she can breathe. And I just put a cushion here, so at home you can do different things to provide the help that every patient needs. When a patient is not on ventilator, usually the nebulizer kit comes with a mask I don't have a mask at this moment because she doesn't need it, but if the patient needs a mask, you put the mask on, and all the and this cup is the same thing. So usually, let's say the people who doesn't require other device, they usually blow the aerosol by the mouth, and that's it. So, but in my daughter's case, it's just simple as this. So, see, she disconnects her trach, so her trachea, but her trachea tube, but doesn't matter. We can put it back again. She don't like this. She don't like this, but she has to have it, so she can breathe, right, Maryanne? Okay, so thank you for watching and have a great day. If you have any questions, please let me know. Bye bye.